Diabetes mellitus is a metabolic disease characterized by hyperglycemia resulting from defects in insulin production, secretion, or action. Insulin is a hormone produced by beta cells in the pancreas, and it allows cells to take up and utilize glucose from the blood. Type 1 diabetes is an autoimmune disease in which immune cells destroy the pancreatic beta cells, resulting in insulin deficiency. It affects 5 to 10% of all diabetics and is juvenile onset. The treatment for type 1 diabetes is insulin injection. Type 2 diabetes is due to insulin resistance and/or insulin secretory defects. It affects 90 to 95% of all diabetics and is adult onset. The treatment for type 2 diabetes is pharmaceuticals that increase sensitivity of bodily tissues to insulin and lower glucose production by the liver. The health impact of diabetes includes cardiovascular disease, kidney disease, nerve damage, limb extremity complications / amputations, pregnancy complications, oral disease, eye disease, and mental illness. Approximately 2,700 students at Western University are affected with diabetes, and approximately 153,000 students at universities in Canada are affected. In London, Ontario, 10.5% of the population is affected. In Ontario as a whole, 8% of the population is affected. In Canada, 9% of the population is affected. And worldwide, diabetes has a prevalence of 8.5% of the population being affected. Diabetes takes more lives than HIV, AIDS, and breast cancer combined. Diabetes costs more than $245 billion annually, and diabetes contributes to 30% of strokes, 40% of heart attacks, 50% of kidney failures requiring dialysis, and 70% of non-traumatic lower limb amputations and vision loss. 30% of people with diabetes have clinically relevant depressive symptoms. The majority of Canadians with diabetes pay more than 3% of their annual income, which is over $1,500 per year to pay for medications, devices, and supplies. Hypoglycemia and hyperglycemia may affect mood and behavior and a student's ability to learn and participate in school activities, as well as lead to emergency situations if left untreated.
My name is Alex, and I am an alumni of Western University. I graduated back in 2016, and I graduated from Ivey with an HBA degree, and I now work in Sudbury, Ontario as an accountant.
Hi, I'm Kathleen. I'm 20 years old. I'm in my third year at Western University. I'm taking business and I'm specializing in accounting.
I was first diagnosed with type 1 diabetes when I was in grade 9, which would have been 10 years ago today, and my sister is also diabetic, so I had similar symptoms around that time, so my mom brought me into the hospital, and then I found out that I was a type 1 diabetic.
I was diagnosed with diabetes when I was 4 years old. I don't remember what was going on, but my mother told me that I was going to the washroom a lot and I had a high fever, so they took me to the hospital and I found out I was diagnosed with type 1 diabetes.
I manage my diabetes with a wireless pump. So I wear this wireless pump, which is on my arm right here, and I switch this every 3 days, and it's running through my system on a 24/7 basis. And I have a PDM meter right here, which looks like a phone, and I use this to count how many carbs I'm having in a meal and distribute insulin to myself and just keep track of everything, which is a lot better than what I used to use, which was just needles.
In the past, I would use needles, so I would test my blood every time I ate, or in the morning and at night. So I would say probably between 5 to 10 times I would test my blood, and then I would give myself insulin needles according to how my blood sugar was. And now I'm on an insulin pump. I'm trying this out as a trial. I use my insulin pump 24/7, so I don't have to test my blood as much, and I don't have to give myself needles anymore, so I'm really liking that.
Diabetes as a student was a little challenging going through university. I always had to carry my testing strips, my PDM with me at all times. Whenever I went out with my friends or was going to an exam or something, I always had to carry this. I had to notify the teachers that I had this, And it's just a little different than everyone else because you always have to monitor things and keep track of your blood sugar and carry things with you to make sure you never go too low or too high.
Living in residence, I would eat at the cafeteria, and there was no nutrition labels that would tell me the carbohydrates I was eating, so it was a lot of guessing. I found that very tricky. Also, as a diabetic, I have to carry my supplies with me all the time in class, during exams, when I'm going out with friends. During exams, I find it very difficult because I have to test my blood before, and some of my exams are 4 hours in length, so I have to test it every hour. And then if my blood isn't good, then I have to react, and I find that takes quite a bit of time out of my exam.
Things I noticed in relation to the Western University community is that not many people are educated on diabetes. So if myself or another diabetic were to go into a low scenario, they wouldn't understand what to do. So if we can educate people more on the process of it, I think people will be more understanding what to do in those difficult scenarios.
Putting biohazard boxes in washrooms would make it a lot easier for me as a student.
Diabetes research that is currently taking place includes type 2 diabetes prevention and treatment strategies, pancreatic transplantation strategies, autoimmune perturbation, including stopping immune cells from targeting the pancreas, and research into genetic reprogramming with regards to immune cells and insulin receptors. To make Western University more accessible to diabetics, we believe the campus should have biohazard bins and specialized physicians available for diabetics. The university should promote awareness and education about diabetes and ease communication between students and faculty with regards to exam and in-class accommodations. The university should also promote a healthy lifestyle and offer support networks for students. The university can also participate in research. To prevent type 2 diabetes, we believe that Western can prevent obesity, which is a risk factor for the development of type 2 diabetes. To do so, we believe Western can increase the physical activity of students by providing access to community recreational facilities, and can help students by forming social support networks and promote educational campaigns that enable people to read and understand food labels, and finally, teach young people to cook nutritious foods. Thank you for listening to our presentation. We hope that you have learned something about diabetes and the impact that it has on university students and what can be done to prevent the harm that it causes.